Chapter 1, The Sciences of Anatomy and Physiology, Part 2. So we last left off with the anatomical position. The anatomical position is the position you should always assume the body is in when you're comparing where two different structures are. So when we think about where things are in the body, we assume the person is in the anatomical position, again with the palms facing anteriorly, facing toward the front. With our medical technology of the day, we can actually cut through the body and view what's inside the body without damaging it at all. So this leads to the development of new terms such as planes and sections. So a plane is this imaginary sheet that cuts through the body, and the section is what you see when the body is cut in that manner. So a coronal section, a plane cuts through the body, separating the front and back pieces, and then when you look at the surface through that cut, that is the coronal section. So coronal section cuts it through to separate the structure into a front piece and a back piece. The transverse section cuts through the structure, the body, giving you a top and bottom pieces, and then this is a transverse section. Again, in both cases, we're looking at the head. You can have an oblique section which cuts at an angle, but most of the time they talk about transverse sections, which are straight across, perpendicular to the floor. And then a mid-sagittal section. A mid-sagittal section is a plane going through the midline, straight down the middle of the body, giving you a right piece and a left piece. So that is a mid-sagittal section. Should the plane cut through and it's off-center, so the two sides are not equal, then that's called a sagittal section. Directional terms are used to talk about the relative position of structures or the different kinds of surfaces on a single structure. So for instance, anterior means that the structure is more toward the front of the body. Posterior means the structure is more toward the back of the body. So the chest is anterior to the back. Then we have superior and inferior. Superior means closer to the top or head of the structure. Inferior means more close to the bottom or feet. So for instance, the belly button is inferior to the nose. Then we have medial and lateral. These are talking about relative to the midline that cuts through the middle of the body. So medial means closer to the midline. Lateral means further away from the midline. So the elbow is lateral to the belly button. The elbow is further away from the midline than the belly button. And then for limbs, if you're talking about structures on one limb, one arm, one leg, then you use proximal and distal. So do not use superior, inferior. Instead, use proximal, distal. And this means that proximal means closer to where the limb attaches to the trunk of the body. Distal means further away from where the limb attaches to the trunk of the body. So the elbow is proximal to the wrist. The elbow is closer to where the arm attaches to the trunk of the body than the wrist is. Again, structures within one limb only replaces superior and inferior. We also have the issue of right and left. If you're talking about right and left, you're always referring to the patient, to their right and their left. Then we also have the two terms superficial and deep. Superficial, closer to the surface of the structure, deep, further away from the surface. So usually this is referring to things that are sort of surrounding each other. It might be layers of a organ, something like that, where it's sort of surrounding each other. So for instance, the skin is superficial to the heart. Skin surrounds the heart. Skin is closer to the surface. The heart is deep to the skin. But if we wanted to talk about the heart in the sternum, we would say the heart is posterior to the sternum. All right, you can break up the body into two major regions. These would be the axial region, which includes the head, neck, and trunk of the body. So the structure is sort of along the midline, head, neck, and trunk of the body. And then the appendicular region. The appendicular region would be the upper limbs and the lower limbs, including the structures that attach the upper and lower limbs to the axial region. All right, here is a figure from the textbook. I think it's figure 1.7 on page 13. You are going to have to learn the names of all of these regions, backwards and forwards. They're going to be on the exam. They're going to be on future exams because we'll be using these terms both semesters of this course. So, for instance, we have the frontal region for the forehead, the oral region for the mouth, mental region for the chin, sternal region for where the sternum is, tarsal region for the ankle, and so on and so on. So learn these backwards and forwards. Be able to point to these different regions on your own body and name them. That's the only way you'll be properly prepared. Body cavities. It turns out many of our internal organs are housed within enclosed spaces, and these spaces are referred to as cavities. And sometimes those organs are also wrapped around by membranes. So, some of the important body cavities. We have the cranial cavity, where you find the brain, the vertebral canal, where you can find the spinal cord. Again, vertebral canal is a cavity, even though it's not called cavity. We have the thoracic cavity in the chest, where you find the heart and lungs. We have the abdominal cavity, where you find most of the intestines, the liver, the pancreas, the stomach. Also have the pelvic cavity, where you find a little bit of the large intestine, the urinary bladder, uterus, and ovaries, if you possess those. And you can combine the abdominal and pelvic cavities together as one structure called the abdominopelvic cavity. Important to point out, the thoracic cavity is separated from the abdominal cavity by a sheet-like muscle called the diaphragm. So there is a physical structure separating the thoracic cavity from the abdominal cavity. However, there is no structure separating the abdominal cavity from the pelvic. It's just an imaginary line lying along the top of the hip bones. If you look at the thoracic cavity, you'll find that it can be broken down into 4 smaller cavities. These include the right pleural cavity and the left pleural cavity. Within each pleural cavity is a lung, and the pleural cavity is formed by the pleural membrane. You have the pericardial cavity. The pericardial cavity houses the heart, and that is formed by the pericardial membrane. The pleural membranes and the pericardial membrane are serous membranes. And then finally, the 4th cavity is the space between the lungs, the space between the pleural cavities, and that is called the mediastinum. So this means the heart could be said to be in 3 cavities. It's in the thoracic cavity, it's in the pericardial cavity, and it is within the mediastinum. Serous membranes. Serous membranes are relatively important, and there are 4 main serous membranes. They are 2-layered structures. They have a visceral layer lying on the surface of the organ, and then a parietal layer that's exposed to whatever surrounds that organ. And then there's a thin little space between the 2 layers, and that space, that cavity, is filled with fluid, with serous fluid. And the serous fluid acts as a lubricant and helps to reduce the friction caused by the movement of that organ. So the lungs constantly expanding and contracting, that stretch and release is going to cause the lungs to rub against surrounding structures, and that friction would cause damage. But the pleural membranes, these serous membranes, are able to protect the lungs. So again, the lungs each have a pleural membrane, and that membrane helps to protect the lungs as it expands and contracts. The pericardial membrane, also called the pericardium, surrounds the heart. Again, visceral layer lying on the heart, parietal layer adjacent to the structure surrounding the heart, a little bit of fluid in between. This is to protect the heart as it's constantly moving, constantly beating. So it reduces friction to the heart. And then the 4th serous membrane is the peritoneum. Peritoneum is an extremely large membrane found in the abdominal cavity. It surrounds many, but not all, organs in the abdominal cavity. It surrounds some, doesn't surround others. It again provides similar functions. It helps to reduce friction from our intestines and stomach moving around, helps to provide lubrication. And also, the additional function for the peritoneum is that it will attach organs to each other and to the abdominal walls. So the peritoneum also helps to hold the abdominal organs in place. All right, you can cut up the abdominal pelvic cavity into 9 regions, the 9 abdominal pelvic regions. So it forms sort of a tic-tac board, as it were. And then the regions would be right hypochondrial region, epigastric region, left hypochondriac region, right lumbar region, umbilical region, left lumbar region, right iliac region, hypogastric region, and left iliac region. You need to remember where these regions are and some of the structures found within the regions. If I ask questions about this, say on the lab portion of the exam, I would include a tic-tac-toe board, hashtag, whatever you want to call it, so that you actually can see exactly where things are in terms of those 9 abdominal pelvic regions. And this setup is usually used to describe characteristics during an autopsy. Then we have the abdominopelvic quadrants. Here we have a little cross where the intersection of the 2 lines occurs at the belly button or umbilical cord. This would include the upper right quadrant, upper left quadrant, lower right quadrant, and lower left quadrant. It makes a lot more sense. This is often used in physical exams to say, oh, the patient has a sharp pain in the lower right quadrant. Again, you'll need to know where these quadrants are and the basic structures that are found in those quadrants. Homeostasis. Mentioned it earlier. Homeostasis is extremely important because it helps to maintain a constant ideal conditions inside the body. 3 important components with homeostasis. You have to have the receptor that detects the changes in the body, the control center, usually in the brain, that will then decide whether or not a response is needed, and then the effector, the structure that causes the response to occur. So again, the stimulus. Stimulus observes some sort of condition and changes in that condition. So it could be temperature, could be stretch in a muscle, could be chemical composition in the blood. That is the stimulus detected by a receptor. The receptor can detect the changes, can detect that stimulus, and then that information gets sent by the receptors to the control center. Control center usually in the brain or in endocrine glands. The control center interprets the information and decides if a response is needed. If the response is needed, then it sends commands to the effector, and the effector will bring about changes to try to restore homeostasis. The effector is always going to be a muscle tissue, or a gland. Again, stimulus detected by the receptor. Receptor sends the information to the control center. Control center decides on a response. The effector causes that response to return to the ideal condition. Most of the time, we're referring to negative feedback. It is the hemostatic control. We're basically trying to move the condition in the opposite direction of the stimulus, so trying to return to normal. Stimulus takes you away from normal. Negative feedback returns to normal. So, say body temperature. Body temperature gets too high. That is the stimulus. In response, sweat glands are activated. The body cools down, returning back to normal. Say the body gets too cold. Now the temperature is too low, and so the action would be, say, shivering of the muscles, which would raise body temperature back up to the set point, and basically constantly trying to keep around that set point of, in case of temperature, 98.7 degrees Fahrenheit. So again, body temperature is too cold. Receptors detect this. Control center says, whoa, body's getting too low. Need to do something. And in response, sweat glands become inactive. Less blood travels to the skin, and skeletal muscles shiver, contract, and generate heat, returning the body temperature to a normal level, ideally. And there are other examples. The withdrawal reflex. Say you touch something that injures you, regulating heart rate, regulating blood pressure, release of insulin in response to glucose levels. There's a lot of hemostatic regulation in the body. So we'll stop for this part of the lecture.